Hi guys, I'm Laser Man. I'm just playing. It's same old Kwame from Physical Therapy, Balance and Wellness of Rockville. Hope everybody's doing great. Fun fact, I don't know if you guys knew this. Do you know 50 million Americans experience some type of pain? That's a lot of people. So what we've started to do here is incorporate laser therapy. It's not new. A lot of people do know about it, but I think a lot of people are skeptical about it. I think the laser here is great for people to experience. Just to let you guys know that the first one is free, so everyone has like a free trial. And the thing about laser therapy, it's good for pain, arthritis, muscle spasms, and inflammation. I think the big thing with those is, so why not do something about it? If you don't like taking medicine, if you don't like going to the doctor, why not try laser therapy? There's a dialogue between you and I, and what will happen is I'll bring you back to the cool laser room. And in the laser room, what will happen is we'll talk and I'll get a feel for what happened. Ask you a couple of questions if the situation is more acute, more chronic. With more acute situations, the laser tends to help fairly quickly with that. With more chronic situations, it may take a little bit longer, but not too much longer. You will feel a difference after the first time you get laser in terms of range of motion, muscle spasms, anything of that nature. For example, if your knee is bothering you, I'll have you do something that bothers it, get a pain scale, get a feel for like how it feels, and I'll laser for about 2.5 minutes. And that will happen about 4 times. Laser therapy sessions can run between 10 to 15 minutes, so it's not super long. You're not in a room all day just laying there, just not being able to move. Again, if it's your knee and extending it, if it's your shoulder and lifting it up. So again, we're just getting a feel for everything. When people think of laser, they feel like, oh, it's gonna burn through my skin. No, that's not what it does. It's a soothing warmth. It's very actually nice. The big thing with laser, it's just helping with tissue rejuvenation. The big thing is just making sure that the area is getting blood flow and just helping out those tissues that just are not working or tapered off to where you're experiencing pain. I'm actually going to give you guys a little demo in a second. Someone who's actually experiencing knee pain now. All right, so we have Renata here. She's been having a lot of knee trouble as of late. So Renata, talk to me. What's going on with the knee?
I have like a little inflammation in my knee and I'm unable to do like a squat. It kind of hurts.
Oh, it hurts, okay. Could you give me like a pain scale?
I think a pain scale would be between a 6 and a 7.
Okay. Can you do me a little favor? Can you actually step down and do a little squat for me and see what it looks like?
Mm-hmm.
All right.
See, when I start bending down,
Yeah.
it gets tighter and tighter.
All right. So it gets tighter and tighter. So you lack range of motion as well.
Mm-hmm.
All right. So let's do this. Let's go ahead and have you lay down on the table. Lay down. All right. I am gonna put some gloves on. And what's gonna happen here is I'm gonna laser Renata for about 2.5 minutes. Like I said, it's a soothing warmth. It's not too hot. Doesn't burn the skin or anything of that nature. And what's gonna happen is I'm gonna periodically have her retest the squat. And in retesting, we wanna make sure that we're showing our patients and the clients that the laser is working and it is helping increase their range of motion. All right? So let's go ahead and get started. The laser is always sterilized. All right, so we always have Lysol. I've already sterilized it already. So it's always sterilized. All right, we're gonna go ahead and turn it on. All right, it's warming up. All right, so let's do this. So let's go ahead and lay the knee down onto the pillow. All right. And we'll go ahead and get started. All right, so you're not gonna feel anything at first. But as time goes on, you feel the warmth, Renata. So when you feel the warmth, let me know, okay?
Okay.
All right. So like I said, it's very, very soothing. All right. And like I said, what I'm doing now is just going over the areas of the knee that kind of seem to be inflamed and have a lot of tightness right now. And then again, I'm gonna do this for about 2.5 minutes or so. Get a feel for how much of the laser is progressing with her knee pains and inflammation and as well as her muscle tightness. All right, so we've hit 2.5 minutes. So Renata, do me a favor. Let's go ahead and stand up and we'll go ahead and see how your knee's feeling. So try to do a little squat for me.
It definitely feels better going down. I don't feel that tightness anymore, and I feel more comfortable putting like my weight on it.
Anyway, exactly. Exactly. With the laser therapy, what it definitely happens is it just helps with, tissue rejuvenation and bringing blood flow to those areas so there's no longer pain. They're getting greater range of motion, and she's able to put weight on it. And as you guys saw, she could squat a little bit lower. So let's do this. Let's go for a couple more minutes. We'll see how it feels. Renata, tell them a little bit about your knee.
I recently just had ACL reconstruction about a few months ago. I'm hitting my 6-month mark, and I've been unable to walk around the clinic and being able to exercise, and definitely getting the laser treatments have pushed my knee and definitely helped it more with the range of motion and my ability to just do basic things like walking, going up the stairs, and exercising.
Mm-hmm. All right, that's good to hear. Like I said, it does vary how many laser sessions that you'll need. Like I said, with more acute injuries, it won't take as long. But with more chronic injuries, I wouldn't say it's going to be long, but there's definitely going to be more laser sessions needed. All right. So we're going to hit our 2.5 minutes again. In 3, 2, 1. All right, Renata, do me a favor. Let's go ahead and step on down. And let's go ahead and see how the squat is looking. It's good. It looks really good. So what's your pain scale right now?
I think my pain scale now is a 0. It's not hurting at all, and it's definitely, I feel a difference from the first time when I did my squat.
Mm-hmm. All right, that's great to hear. In due time, with laser therapy, a lot is possible. Hi guys, my name is Kwame. I work for Physical Therapy Balance Center of Rockville. I have here with our guest,
Janet Mitchell.
Okay. Miss Janet has a great story in terms of just how laser therapy has just helped her everyday living, especially with sports. She's very, very active. Plays on probably one of the best softball teams I've ever heard of in my life. I actually did go and watch them play. So Miss Janet, let's get a little bit about your story. So how did laser therapy even come about?
Well, I come to physical to work out, and also for physical therapy when I have sports injuries, and I've had a lot of sports injuries.
Mm-hmm.
And so I noticed that it was advertised here with a list of things that it could help. Most of those I've had. So I just thought maybe it could help this persistent pain that I was having in my hip, in my lower back hip area, which I felt was maybe related to some inflammation or a muscle strain type pain. So I tried it with Kwame, and the very first session made a big difference. And I think we did maybe another follow-up session. I know I've had 5 or 6 on different parts of my body, all kind of related to inflammation, sports injuries. And the effect for me has been, it's immediate. Kwame stops the treatment after, maybe 5 minutes, and has you tried things that have been painful when you come in, just to sort of gauge, are we in the right place? Is it helping, or do we need to go longer? And it's the process just, immediately helped me in terms of mobility and in terms of not feeling that persistent pain that I had been feeling. It was really very helpful. It's another tool in the toolbox for staying active.
No, for sure. And for those of you that don't know, she does play on a softball team. So let's talk about how sometimes we would incorporate laser therapy around softball, because I think right before you left for a tournament, you actually came and got lasered.
Yes, I did.
To see
Yep.
if it was gonna last, and it ended up lasting the whole tournament.
Yeah, it helped me a lot. I think we've done it on a muscle in my leg where I was having kind of a little bit of a muscle strain, inflammation, and I think that might be what we did, and perhaps it was the Achilles area maybe as well.
Yeah.
I've had so many I can't remember. But yeah, it helped. It alleviated the issue. It allowed me to play in the tournament. We before this virus, we traveled a lot and played in a lot of tournaments around the country. So it's 6 or 7 or 8 games a weekend. That's a lot when you're 63. So anything I can have that helps me cope with that is really something I'm going to continue to do.
Okay. Last question. What would you tell somebody who's kind of on the fence about laser therapy? What was the one thing that you would tell them?
Well, I would say that it's very easy, it's very relaxed. What do you have to lose by trying it? It's certainly not going to hurt you. You don't feel anything. It's, like I said, the session is very easy and relaxed with Kwame, engaging with you the whole time. And seeing how it's going. There's no pain to the process. You know, if you're having something where other things haven't worked, this is just another thing to try and see if your body responds to it. I would say go for it.
Janet, it's been an absolute pleasure talking to you. I hope all is well. And hopefully you can get back to playing softball, after all this over.
I hope so.
All right, thank you guys for joining us in our laser therapy session. Just to let you guys know, from May 27th to Wednesday, June 3rd, we are having a promo on laser deals. So definitely call our office, email us, and look out in the office, on Facebook, and on YouTube for any other questions that you have. All right, bye.